Okay, guys, this is case number 4. So we look for the age, and it's 2-day old, a 2-day old baby boy. Okay, and then we go to the symptoms right away. Symptoms. We go. It says it was taken because of frequent vomiting. So frequent vomiting. Okay? The child was born to a 40-year-old mother who reports she did not undergo any prenatal testing, including amniocentesis or karyotype analysis. The mother reports that since birth, the boy has been vomiting greenish material immediately after eating. Greenish, this is important. The color is very important. So it is greenish, and it is right after meals. Okay, which means that it's really quick. It should be a high up obstruction. He also becomes lethargic and progressively less responsive. So we're really right. Lethargic and progressively less responsive. On physical examination, we have prominent epicanthal folds, okay, absulating palpebral fissures, and macroglossia. Macroglossia. He also has thick skin at the nape of his neck. Thick skin. Here. X-ray of the abdomen is shown in the figure, so I'm going to show you. All right. Right here. And it looks to me like a double bubble, but let's see, okay? We go to the first question. What is the likely diagnosis? So guys, with this in mind, this is our secret. The information we need really quick. The one that we need to gather, nothing else. We think about the age, we think about the sex, we think about the symptoms, and then what we find, okay? In the X-ray. We look in here for the pathognomonic thing of the condition, and that's our secret. And we go right here, and we say, okay, what is the likely diagnosis? Likely diagnosis. And they gave us these, which to me looks like Down syndrome, okay? Microglossia, prominent epicantral folds, and so on. So here, we got it right. The child most likely has Down syndrome, which can be associated with gastrointestinal disorders, such as duodenal atresia, or stenosis, annular pancreas, tracheoesophageal defect, and imperforate anus. Duodenal atresia below the sphincter of Oddi causes bilious vomiting, as seen in this patient. Below the sphincter of Oddi. So it is high, but look, it is below the sphincter of Oddi, and this is very important. So diagnosis, Down syndrome. Okay? And we think of the greenish. The greenish is the key, vomiting, which means duodenal atresia below the sphincter of Oddi. Okay? What is the most common cytogenetic abnormality in patients with this condition? Cytogenetic abnormality, we need to know this. More common cytogenetic abnormality. Trisomy 21. Okay? And look at this. Resulting from non-disjunction of chromosome 21 during meiotic anaphase 1 or anaphase 2. All right? During meiotic anaphase 1 or anaphase 2, the risk of non-disjunction increases with maternal age. Okay, let's go to another one. What screening is available in utero for this condition? So we go for the markers of Down syndrome in material blood. Reduced levels of alpha-fetoprotein, pregnancy-associated P protein, and estradiol. And we need to write that down. Screening, in utero screening. We do that to every patient, or we offer that to every patient in Canada. We go for reduced levels of alpha-fetoprotein, pregnancy-associated P protein A, and estradiol. Okay? Alpha-fetoprotein, estradiol, and PABBA. Elevated levels of beta human chorionic gonadotropin and inhibin. We need to know that. Increase levels of beta human chorionic gonadotropin and inhibin. Also, ultrasound measurement displaying increased nuchal lucency, I'll show you really quick, may also be seen. A definitive diagnosis can be made via karyotype analysis of fetal cells obtained via amniocentesis or chorionic villus sampling. This is a little bit aggressive and is more for patients that are older. Okay? Now we go here and we say, what other medical abnormalities are seen in children with this condition? A single palmar crease, small folded ears, short neck, brush-felt spots, pale yellow spots on iris, and a gap between the first and second toes. They also suffer from heart disease, most often cardiac cushion malformations, and may have ophthalmologic problems, gastrointestinal tract malformation. So this is cardiac cushion defect, which is thickening of part of the heart. Now we go here, and I'm sorry about this, it was my daughter playing. Look at this: poor hearing, cognitive disability, and developmental delay. Okay? Males with Down syndrome are almost always infertile. Individuals with Down syndrome may also have atlantoaxial instability, which is really bad. It's at the back of the neck, increased movement between the C1 and C2 vertebrae, which may lead to spinal cord damage. You see, it's at the back of the neck. Fetal alcohol syndrome, in comparison, is characterized by a thin vermilion border, which is in the mouth, small pulmonary fissures, and a smooth philtrum. All right? Now, later in life, what disorders is this baby at risk of developing? And this is very important. Later in life, we just write it down here. Later in life. So they get Alzheimer's, okay, and they're also at increased risk of hematologic disorders, acute leukemias. So this one is an average of 50, age 50, Alzheimer's. And the acute leukemias is in children. Childhood. Most commonly acute lymphoblastic leukemia. A lymphoblastic leukemia. Okay? Okay, guys. Thank you for watching.